We continue our conversation with Dr. Mickey-Barber from Cenegenics. She's the CEO. In 2013, just last year, Dr. Barber was awarded the top honor in her field. She was presented with the Alan P. Mintz Award for Clinical Excellence in Age Management Medicine. What's the difference between age management medicine and anti-aging?
Good question. We just don't... We know we're going to age, and we're not against aging, and we can't stop aging.
We can't?
I know we can't.
Okay.
What we can do is manage it. Make sure that, we get through that process on the winning side. And so we just talk more about age management and not being against aging. I mean, if you aren't aging, you know what the alternative is.
Yeah, you're looking up at the sky instead of down at the dirt.
Exactly.
Right?
Exactly.
Before our time out, I was kidding, but in the South, and I've spent a lot of time in South Carolina, in over in Columbia, and in Charleston, and I love Charleston. I think it's a great city, and it's a good food city. But everybody eats grits. I mean, shrimp, cheese, grits. I don't get them, but I don't get them, and maybe it's because I'm from Southern California, but. And I did eat them. When I lived in Memphis, I ate them in the morning, and I made it like a cream of wheat. I put a little bit of milk on it and honey, brown sugar, something like that, and I could eat them that way. But if they were by themselves, they'd be really healthy. But right?
Yes, they'd be pretty healthy.
Pretty healthy.
They're a high glycemic food, so they tend to elevate our blood sugar quite a bit. But you're right, we put in the South quite a bit of cream and butter and God knows what, bacon sometimes, to make them more palatable, I guess. Yeah,
exactly. And all that cream. In your nutrition counseling to patient Mark, would you say, hey, Mark, knock off the fats a little bit. Don't eat that bacon. It's one of the best things that God ever created in terms of aroma, but it's not good for you. Stop it.
Well, we certainly would. And, I always say bacon is a sign there is a God.
Yes.
It's so delightful. Unfortunately, he or she didn't manage to make it healthy at the same time. But we would certainly ask our patients and do every day to limit those saturated fats, particularly animal fats. But, we really focus a whole lot, Mark, on the sugars, really eliminating, of course, refined sugars, but really watching those hidden sugars or sugars we don't think about that tend to really bump our glucose or our blood sugar up and subsequently our insulin levels and cause us to hang on to more fat in the belly and put our triglycerides through the roof. So it's a balance of healthy fats, low glycemic foods, and moderate lean protein.
Well, we've really enjoyed our conversation. I'm sorry, Daryl. I saw that wrong. Do that one more time for me. Oh, that's what I thought. Never mind. We're continuing our conversation. We have 3 more minutes. Back to the hormones. Is that something that everybody over, say, the age of 45 or so should look at and consider?
Well, hormones are not for everybody. Definitely not for everyone. However, anyone over the age of 40 is suffering from a decline in what I consider to be the good hormones, and in many cases, an increase in the not-so-good hormones. And by that I mean a decline in hormones like testosterone, DHEA in men, growth hormone in both men and women, estrogen and progesterone in women, and an increase in cortisol, which is our stress hormone, and insulin, which I just mentioned. So it's really, you're experiencing that if you're over 40. The question is, are there any things about your health history that makes us think that you would benefit from bringing those up to an optimal level? And in most cases, in my opinion, the answer is yes.
We've had a number of guests on from both the medical and alternative health field talking about bioidentical hormones, and most of the people that we talked to have said that yes, these are something that almost everybody, as you have said, should have. I mean, if somebody has prostate cancer or breast cancer or other indicators, they shouldn't take it. But it should be almost like in our water for people over 40.
Well, it's true, because the loss of those hormones results in a lot of the things that we see associated with aging, osteoporosis, heart disease, muscle wasting, dementia, fragility, diabetes, sleep disturbances, sexual dysfunction, low energy, all the things we don't want.
Right.
Because I think of it, Mark, as we are outliving our chemistry.
Well, my brain is still alive. It's my body that I need to take care of. From Synergistics, Carolinas, Dr. Mickey-Barber has been our guest. Thank you, Doctor. We'll talk very soon.
Great.
Okay?
I look forward to it.
I look
Thanks
forward
so
to it again. Thank you very much. All right. Next, you're going to meet Gia Marquez. She's a Pilates expert, and she's going to talk to us about why Pilates is good for you. I'm Mark Allen. Late Night Health continues.